Depression is a mental health disorder that affects a person's mood, thoughts, and behavior. It is a common and serious medical condition that can interfere with daily activities, relationships, and work. People with depression may experience feelings of sadness, hopelessness, and worthlessness, as well as changes in appetite, sleep patterns, and energy levels. They may also have difficulty concentrating, making decisions, and experiencing pleasure. Depression can range from mild to severe and can be treated with a combination of therapy, medication, and lifestyle changes. Depression can cause a wide range of symptoms that affect a person's emotions, thoughts, and behaviors. The severity, frequency, and duration of these symptoms may vary from person to person. Some common symptoms of depression include persistent feelings of sadness, hopelessness, and helplessness, loss of interest in activities that were once enjoyable, including sex, changes in appetite, weight, and sleep patterns, fatigue and lack of energy, difficulty concentrating, making decisions, and remembering things, irritability, restlessness, and agitation, feelings of worthlessness, guilt, and self-blame, thoughts of death or suicide, social withdrawal and isolation, physical symptoms such as headaches, digestive problems, and chronic pain. Depression is a complex mental health disorder that can have multiple causes. Some of the major causes of depression include biological factors. Research suggests that imbalances in certain chemicals in the brain, such as serotonin, dopamine, and norepinephrine, may play a role in the development of depression. Genetic factors can also increase a person's susceptibility to depression. Environmental factors, traumatic life events such as loss of a loved one, relationship problems, financial difficulties, or a stressful work environment can trigger depression in some people. Other factors such as chronic illness, substance abuse, or a history of abuse or neglect can also contribute to depression. Psychological factors, certain personality traits such as low self-esteem, negative thinking patterns, and a tendency to ruminate on negative experiences can increase the risk of depression. Stressful life situations such as major life transitions, chronic stress, and a lack of social support can also contribute to depression. Medical conditions, chronic illness. Some commonly used terms to describe the levels of depression include mild depression. This level of depression involves symptoms that are present but do not significantly interfere with a person's ability to function. Symptoms may include feelings of sadness or hopelessness, changes in appetite or sleep patterns, and fatigue. Moderate depression. This level of depression involves symptoms that interfere with a person's ability to function on a daily basis. Symptoms may include persistent sadness or anxiety, difficulty concentrating, changes in appetite or sleep patterns, and feelings of worthlessness or guilt. Severe depression. This level of depression involves symptoms that significantly impair a person's ability to function and may include suicidal thoughts or behaviors. Symptoms may include intense feelings of sadness or hopelessness, severe anxiety, difficulty sleeping or oversleeping, physical symptoms such as headaches or chronic pain, and a loss of interest in activities that were once enjoyable. Some commonly used treatments for depression include psychotherapy. Psychotherapy, also known as talk therapy, involves meeting with a mental health professional to discuss thoughts, feelings, and behaviors related to depression. Different types of therapy may be used, such as cognitive behavioral therapy, CBT, or interpersonal therapy, IPT, to help a person learn new coping skills, identify and change negative thought patterns, and improve communication and relationships with others. Medication. Antidepressant medications may be prescribed to help regulate imbalances in brain chemicals that contribute to depression. Different types of antidepressants may be used, such as selective serotonin reuptake inhibitors, SSRIs, or serotonin norepinephrine reuptake inhibitors, SNRIs. It's important to note that medications may take several weeks to become effective and may cause side effects, and should only be prescribed and monitored by a medical professional. Lifestyle changes. Certain lifestyle changes can also be helpful in